Welcome back to Body Beautiful. With us today, we have plastic surgeon Dr. Joseph Mealy, and we're talking about cosmetic breast enhancements. Let's go ahead and go to the phone lines, shall we? We've had Mary Jane from Santa Cruz on the line. Mary Jane, you have a question for the doctor?
Yeah, hi. I had implants done in 1980 at Stanford, and I'm 67, and I'm a lot shorter than I used to be. And after a while, you kind of wonder whether you should have done it. I had flat breasts from breastfeeding 5 kids.
Sure.
So I did it then, went from an A cup to a C, and now I'm wondering, one's encapsulated and not comfortable.
Sure. No, that's a good reason to see a board-certified plastic surgeon again, because capsular contracture really has 4 stages. Grade 1, can't really tell there's a scar there. Grade 2, it starts to get a little firm, but no one's really upset about it. Grade 3 is when it starts to distort or move the position, and grade 4 is when it actually becomes painful. Now, that's the most unusual capsular contracture, but it's the one that we will operate on most frequently. And it can be as simple as just opening up the scar around the implant, or if you've got some consideration of whether to change size or remove the implants, that certainly could all be discussed at the same time. But be sure to see someone who does a lot of breast augmentation, and they can give you good advice in terms of what to expect, especially if you're deciding to remove the implants, because removing the implants will definitely change the shape of the breast. And at some point in life, there are folks who don't really care what their breasts look like anymore, but I always do, and I want you to be happy with your breasts. So it's good to know what you're getting into.
Well, also, it sounds like Mary Jane, if she had it in 1980, that's, what, 30 years?
30 years. And the other thing that would be important to get followed up with is implants before 1985 have a higher risk of leaking. And if they're silicone implants, it can be difficult to tell if there's a leak. So it may be something where an MRI would be in order if you're planning on just leaving them in place to be certain that they're still okay.
Okay, thanks, Mary Jane. I've got Dawn from Hillsborough wants to know, she wants to get a breast reduction that's medically necessary. Does insurance cover a procedure
breast reductions?
Like that?
Yes, it depends on the insurance. There are some insurance plans that are now excluding breast reduction, which is unfortunate because it's a very good procedure, especially for people who are uncomfortable. I think the important things to remember are, again, to see a board-certified plastic surgeon. They will know what questions to ask. There are certain symptoms and certain sort of procedures that the insurance companies want to be sure that the patients have gone through before going to surgery. And there are also, believe it or not, limits on the amount that we can remove. By that I mean we have to remove a certain amount in order to qualify for some insurance plans. If we're removing less than that, they will not cover the procedure.
Okay, let's go ahead and take Heather from Rohnert Park. Good morning, Heather.
Hi.
Hi.
Good morning.
I have 2 questions.
Yeah.
The first one is, what considerations should one take if one is planning on breastfeeding children after implant?
Sure. I think it's important to know that when an implant is placed, there's a likelihood that less milk will be made. Now, the milk isn't tainted, it's not changed at all. The current recommendations for women with implants is to go ahead and breastfeed. But if it's something that's very, very important to one of my patients and they're trying to get pregnant and they're thinking about having kids soon, I would recommend waiting until after they have children to get the breast implants placed. It also can be done at a time when maybe there's some other trouble if the volume has changed, and that can be corrected also.
Okay, Heather, did you have a second question?
Sort of an off-the-wall one. Have you ever done breast implants on men?
In San Francisco, up until recently, I think that was actually covered on the insurance. But it's for patients who are transgender, so men who are living as women who feel like they are a woman. They do often have breast implants to enhance their physique, just as a person who's born a woman would.
All right, Heather, you can ask an off-the-wall question, and the doctor will go ahead and try to answer it. Speaking of that, we alluded to this earlier in the show. Do men have breast reductions? Because
more frequently than augmentation, yes. Breast reductions are done to reduce either what they call puffy nipples, where the nipple and the areola are puffed out by a little bit of breast tissue, or sometimes it's just that they're a little overweight, and even when losing weight, it preferentially stays in that area. For times when it's fat, liposuction works very, very well. For times when it's the gland, usually a small incision needs to be made to remove that gland. And in those cases, I always send the tissue, just like I do with the female breast reduction, to be sure there's not something in there that shouldn't be. We always worry about breast cancer and such. Sure. It's not likely, but it's always worth checking out.
You know, it's certainly with adolescents, too, it's very psychologically damaging to a young man who can't wear T-shirts or if he's in the gym.
And very common, and it's good to know if you're an adolescent male, very common that will happen at the beginning of puberty, and often it will resolve. So that's something we usually watch for a year or so, see what's happening. If it's not resolving, it's more problematic, then we want to take care of that.
Okay. All really good information. Doctor, we have run out of time. It's great to have you on the show, but for folks who want more information about Dr. Mealy, you can go ahead and call him directly. I'm sure he'll be happy to take your calls.
Be happy to.
925-943-6353, or check him out on the web at drmealy.com. He's also got a brand new website, and it's just about breasts. It's called SanFranciscoBreast.com. That'll wrap it up for us. Thank you very much, Doctor.
Thank you, Vicki.
And join us again for another edition of Body Beautiful. Meantime, have happy holidays and Happy New Year. Bye-bye, everybody.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.